Blood is one of the most essential health products. However, a funding gap this financial year has led to a temporary shortage of blood across the country. A visit to Uganda Hospital reveals an empty blood bank.
Twali stocking omusaayi ogwera, but in the last 1 week gutuweireku kuba abalwaire tulina bangi. Abaana bagwetaaga ino, abakyala abazaala bagwetaaga ino. So gwatuwakune twali tugire nga tufunafuna ku units butono okuva ejinja, like yesterday twafuneyo ku units 6 aidaawirewo deyandireni.
The funding gap has led to a delay in the supply of reagents, which the Uganda Blood Transfusion Services procures from national medical stores. These reagents are used to test blood to confirm its safety for transfusion. Each unit of blood requires testing reagents worth 107,000 shillings. Uganda Blood Transfusion Services needs at least 32.2 billion shillings to remain fully operational. However, they were only provided with 12.8 billion shillings. This left a funding gap of about 19 billion shillings. At a press conference last week, the Executive Director of Uganda Blood Transfusion Services said the National Blood Bank is fully stocked with units of untested blood.
For the last 2 weeks, we have had this big problem. We have been storing it in our cold rooms, and we have not been able to give this back to the hospitals because we didn't have the reagents, the necessary reagents that are supposed to test this blood to make it safe.
Sources NTV has spoken to blame the shortage on National Medical Store's refusal to supply reagents because Uganda Blood Transfusion Services could not pay for them. However, Dan Kimosho, the spokesperson of National Medical Stores, in a WhatsApp message said, "Nobody can make such an accusation against NMS. We have supplied to Uganda Blood Transfusion Services all the reagents in line with the funds made available to us. I am sure Uganda Blood Transfusion Services has screened and made available blood to all in need." Emmanuel Ainebiona, the Senior Public Relations Officer in the Ministry of Health, says following a letter from the Ministry of Finance, National Medical Stores supplied the needed reagents and currently 32,000 units of blood are being tested.
We do not have a shortage of blood because there is blood at the blood bank. However, the blood bank needs to be supported with enough budget that can enable them to mobilize, test enough blood that is needed to save lives.
However, many hospitals are still grappling with blood shortages.
Actually, we have almost 0 of Group O. We have about 4 of Group A. And we don't have Group B. AP is there, about like 2 units.
Although the Ministry of Health says everything is back to normal, this normalcy is yet to return to hospitals across the country. Gillian Nantume, NTV.